Hello, this is Dr. Paul Cottrell, and I'm going to be talking about a few things in a series of videos that I'm going to be doing today. One topic that I'm going to be discussing is about my father, some updates, and maybe individuals that are going through the same thing with their parents, how to manage through it. There's a lot of ups and downs when you have a parent going through dementia. The other topic I want to talk about is what's going on in the financial markets and how you can brace yourself if you're just the average long-term saving for retirement kind of person, and how individuals that are more active can can position themselves in this market. So on the first topic here, my father, he's in his late 70s. For the ones that don't know, in 2021, in the summer, when I was doing my data collection on my research, my master's thesis at Harvard, and I was doing the data collection for the TAP protein to treat GBS, Guillain-Barré. He stopped eating, lost a lot of weight, and my brother happened to go to my parents' house, just to stop by. He periodically, every few weeks or so, went to stop by. And my father was not responsive in the chair. He was kind of passed out. He was breathing, his heart was pumping and all that, but he was just non-responsive, and wasn't eating. He was very dehydrated. So my brother ended up calling the EMS unit, and they transported him to the hospital. He was in the hospital for about 13 or 14 days. His kidneys were kind of shutting down. He had a really bad electrolyte imbalance. They were afraid that he would go into cardiac arrest. He wasn't responsive with his brain activity, and we were concerned that he had stroke at that time. Because we didn't know what was going on. Now, going back in time, when you look at your parents and you see, that something's happening, right? And you think it's just age, just the normal aging process. But you can go back in time and you can say that moment was where it starts. But you don't realize it until after the fact. Kind of like markets in a way. You don't know where a price is going to move until after the fact, right? You can do some predictive analysis, but you really don't know until after the fact, the behavior that's starting to emerge. Something very similar happens in medicine. When there is a series of things that cascade and the system, the body, starts to crash. Maybe we're kind of seeing that in the markets with the banking industry, but let's just stick with dementia at the moment. That moment in time, when I sit back and think about it, was around the summer of 2018. My father was caring for my mother. My mother was ill for many, many years, diabetes, COPD, heart condition, so couldn't move around that much, had problems with her legs. So she had a lot of problems, and she had these for many, many years. The heart disease started at age 40. She passed away, I think it was when she was 74. But the heart disease was with her since she was 40 years old. She had her first heart attack at age 40. They had 5 stents over the years. She had COPD, for about, I want to say 8 years or so. And it was really bad in the last 2 years before she died. She was epileptic for almost her whole life. She was epileptic when she was a child. So, a lot of problems that she had. So my father was caring for her. And he came from an environment, many people on his side of the family lived into late 90s. We really thought he was going to be a centenarian. He was fit. He, didn't have any real medical issues. He had slight increase in blood pressure, but nothing that couldn't be managed. So he was, on a statin and, some sort of, I don't know if he was on a beta blocker or if he was probably on an ACE inhibitor. But, they were controlling his blood pressure. It was minor. It wasn't that big of a deal relative to what on my mother's side of the family, where it's uncontrolled. And, controlling his cholesterol. He walked all the time. He was a very active person. He read a lot. He liked talking to people. He worked for AstraZeneca as a sales rep for many years. He was in pharmaceutical sales when he left teaching. And he left teaching in the 70s and went into pharmaceutical sales. So, the 80s was kind of a big boom for small pharmaceutical companies that ended up starting to get bought out by the larger ones like Pfizer and Johnson and Johnson and all that. So during that 80s, there was an accretion. So he kind of rode that whole wave and eventually ended up at AstraZeneca and retired there. But, he was very active. He was always talking to people, conversing, walking a lot. So, he was an active person. We really thought that he would live to about 100. He'd probably start really ailing in probably his mid 80s, maybe, or late 80s, and that he would outlive my mother. So he'd be basically the caregiver, and that's how we set up the whole situation with my parents. That he would be the caregiver, we would help out, and it would wind down that way. So in 2021, fast forward. So in 2020, in 2018, I get a call. This is one of those points in time where you look back. This is like the start of it. In 2018, I get a call. I'm working on at Catholic Charities on the budgets and forecasting. We were doing the budget for that year, and I was also managing the portfolio. I get a call. I was in a meeting. It was in a budget meeting, and my father seemed kind of frantic on the phone. And because my mother had weak legs, and she was having feeling problems with her legs because of the diabetes, she wakes up in the morning and having problems moving her legs, and she was falling. So he kind of didn't know what to do. And one of the first signs of dementia is kind of like when something new is arriving in your selection set or in your environment, you don't know what to do. You kind of like freeze, kind of like almost like a deer in the headlights kind of thing. There's a frozen thing going. You could tell that he was just starting to stutter, just a little bit though, just a little bit. So if you're not paying attention, you don't catch it. He really didn't know what to do. But this was after he called the EMS unit, and he was kind of like frantic. So she was in the hospital for, I don't know, a day or so after that fall. And then they ended up suggesting that she does rehab to strengthen her legs. Um, and they thought that maybe she had one of those mini stroke, what is called a mini stroke, where you kind of lose you lose use of your lower extremities for a little while, but it's not really a major thing, and that you can give them a fibrolytic and dissolve the clot as long as you catch it in enough time. So it's kind of like a mini stroke that she had, and she was having problems with her legs, and everything starts to stabilize. She's doing her rehab, she's getting some strength in her legs. Now that's in 2018. Okay. Now she continues to decline in her health, right? But around later in 2018, my father, who would talk on the phone all the time, I used to talk to him on the phone all the time, and it was very in-depth conversations, very intricate. He was listening, and he would inject, his thoughts, and it wasn't just he really participated in conversations, and he wrote very fluently. But around late 2018, his fluency in his emails were starting to erode, and the paragraphs became smaller and smaller. The sentences didn't start to make sense, and it got to the point where it was only a few word sentences. So you're talking about someone that would write multiple paragraphs in an email to just a few sentences, or just a few words in a sentence, from late 2018 to about, I want to say, about near the end of 2019. This is all before COVID hits, all right? So, he's starting to, so we're kind of thinking, okay, Alzheimer's is starting to kick in, right? Now, the difference between Alzheimer's and ischemic dementia, which is what he has, ischemic dementia, is that Alzheimer's is, not to get into the molecular biology of this, but, Alzheimer's is a little bit, it's more related to amyloid plaque buildup and tau protein entanglements. Now, with ischemic dementia, it's more about blood flow. It's about there's a lack of blood flow, and neurons are starting to die off. It typically, because there's many different types of dementia, but typically in Alzheimer's, it's a much longer duration. It's a slower progression. It could be 10 years, right? So that's what we were thinking that was happening. Once we started seeing that he wasn't talking on the phone as fluently, and his emails were discombobulated. He would forget his password and stuff like this. This is the forgetting starts. My mother was even saying that she noticed that he was forgetting to get certain things at the grocery store, because that's what he would go to the grocery store and get stuff for the house. So he would forget. That's all happening around 2018, 2019, before COVID. And but we were kind of like going, okay, I'm thinking statins are maybe the cause of this. I'm not a big fan of people being long-term on statins. He must have been on statins and an ACE inhibitor for probably about, I don't know, I want to say about 15 years, maybe 10, 12 years, something around there. And, I was thinking maybe it's that. And I mentioned to him, I'm concerned about what I'm seeing, that maybe you need to go to the doctor. Now, he was a person that wanted to keep his health as good as possible, going to the doctors regularly, every year, making sure that his teeth are clean. I mean, he was always going to the doctor. He wasn't a hypochondriac, but he would make sure that his health is good. And that started to decline. That willingness to go to the doctor started to decline also. And Then COVID hits, right? And I would talk to him. I kept on saying, okay, I'll see you guys. I got to do this for going back and forth between. At this time, I'm going back and forth between. Um, I finish I finished my pre-med in 2019 at Fordham, and then I'm working on my master's thesis right when kind of COVID hits. I was doing the proposal. So I said, okay, I'm going back and forth between New York and Boston. I don't have time to go to Michigan, after I get past this. So I kept on delaying to go see them. And then it gets worse with COVID, and no one wants to travel, and covering COVID and dealing with doing my finishing up my master's, and then I was just starting my medical, my MD education. So I was really, really busy. All right. And my father continues to decline. You can see it. He stops doing the emails, but you can see it in how he was stuttering on the phone. It'd be like, how you doing, Dad? I'm okay, kind of thing. Everyone has gone through, seeing a parent go through this knows these kind of like early signs, right? He was still healthy, physically, still eating. My mother and father are like the opposites. Her physical health was really poor. Her mental health, her mental cognition, right, was really good. It's totally the opposite of my father. My father's was let me rephrase that. My mother's physical health was really poor, but her mental capacity was good. My father's physical health was good, but at this time his mental capacity was declining rapidly. That's another sign of ischemic dementia. It's like it's rapid. But at this time, and ischemic dementia is misdiagnosed easily because it's almost too late by the time you catch it. We kept on thinking, okay, this is Alzheimer's. All right. And I kept on thinking that maybe the statin is exacerbating it. So I continued to tell him, you need to go see a doctor. He declined. And my mother kept on saying, oh, it's just, he's getting older. It's just getting older. And I mentioned it to my brother that I was concerned. And he said, oh, he's just getting older. He's just aging. So everyone was in this mindset, Alzheimer's. Meanwhile, it was really ischemic dementia. So, so the first signs that I was able to see were through the emails and that call when my mother fell because of her weakness in her legs with this kind of like mini stroke in 2018. Now it rapidly progressed. It's getting worse in 2019, and in 2020 it was really starting to take hold. You really could see that he was really struggling to get words out. He was no more writing. He was having a lot of problems with, he could understand, but he had a lot of problems finishing a sentence. And so fast forward to 2021, summer, I'm doing my data collection for my master's, gives me the call that Dad, had to go into the hospital. And with my brother saying that he had to go in the hospital, we weren't sure if he was going to make it. It was that dire. All right. He could have died. I mean, he was probably on death's door, probably within 36 hours. He didn't eat. He wasn't hydrated. There was concern about his kidney function shutting down, cardiac arrest, wasn't responsive. So they really tried to stabilize it. Normal fluid levels did not help kind of kickstart the system. Normally when a patient is severely dehydrated and their electrolytes are off, you're hydrated, right? That didn't work. I mean, it helped a little bit, but I mean, it didn't really get him back. So they put a feeding tube in, and for about 12 additional days, because he was in the hospital for 13 or 14 days. They slowly got him back. But it was, and this is an important point here, it was very difficult when my brother and I were looking at this. What do we do? Do we let our father pass without putting the feeding tube in, without going through extraordinary measures to keep him alive, and let him pass? Or because at that time we didn't know, did he have a stroke? We didn't know a lot, right? Would he be able to get back to where he was? And the reality is no. I mean, he couldn't get back to where he used to be pre 2018, right? And that decision, feeding tube, and maybe he gets through, he doesn't have cardiac arrest, and maybe through rehabilitation, he would have better brain function. Or for sure, within probably around 36 hours or so, he would die. When you're in that kind of situation, no matter which way you pick, you just don't know. Because if you pick to not intervene and let them pass, then forever in your mind, you're always going to say, what if we did intervene? We accelerated his passing, right? We took the route, intervene, feeding tube, and, let's try to keep him alive and see what happens. And it took 14 days or so, 13 days before he could be transferred to a nursing home. First, he was transferred to a rehabilitation center and then transferred into kind of this quasi-rehabilitation nursing home. So when you pick the route of intervening and the parent cannot get back to where you remember they used to be, then you have the guilt that you intervened. It's this concept that I'm bringing up about individuals having to deal with a parent or a loved one in your family, and you have to make that decision of intervene or not intervene, and you don't know there's no good path. It's not like, okay, broken arm, intervene, fix the arm, everything's okay. This is more complicated, especially when you're dealing with brain function. In only hindsight, one could say, okay, probably the better path, because at this time, we didn't know what was going on with my mother, right? So fast forward now, in 2022, my mother dies, right, from SARS-CoV-2 in a nursing home. All right, my father's the caregiver. Once he was put into the hospital, my brother would show up regularly to make sure that she's okay, because he lived relatively close. But she was declining. because he was the caregiver. So she was declining as he was declining at home, but she advanced her decline when he was in the hospital. So she fell again. She was always falling because she had weak legs. And so had her go to the hospital. And again, they go, well, you're going to have to be admitted. You can't care for yourself anymore. And she was fighting that. So you're dealing with a parent that doesn't want to be in a nursing home, but needs to be, and has a lot of comorbidities. This is all happening in the late summer of 2021. So my father's in the hospital. My mother, shortly after that, falls, gets admitted to the hospital, and then eventually transferred to a nursing home. And then my father's transferred to the rehabilitation of the nursing home, all within the fall of 2021. This is all happening in such a short amount of time. So everything's starting to crash from July to September with my parents. My mother ends up dying in January of 2022 when she's in the nursing home. She ended up having cardiac arrest because of a respiratory infection from SARS-CoV-2. It created so much pressure that the fluid buildup in her lung was so severe and so advanced that she ended up having heart failure. So this is the reason why I was saying, you got to pay attention to the white lung, because the white lung is exactly what happened to my mother, except she had a lot of other comorbidities. So, but the catalyst, and it was quick, she tested positive, and 2 days later, she dies. But she was having the symptoms before they tested her. So she'd for a day or a day and a half or so. So, but it was rapid. Within a 3 or 4 day period of actually contracting it, the fluid builds up, and she had a heart condition. She ended up having heart failure. That all happened in January 2022. And when you start thinking back, and you go back and you look at all of the things that were happening, that was transpiring in 2018, in 2019, in 2021, sometimes parents kind of go together, within a year, right? My mother was gonna go in 2022. If we didn't intervene, my father would have died in late summer of 2021. But because of our intervention, his body is well, but his mind is gone. So fast forward to where we're at right now in 2023. He's still in the nursing home, but with ischemic dementia, even with really good care, it just gets worse, right? And there's these phases that happen with dementia. The early phase, you can't write so well. You may be forgetting grocery lists, people's names, people's faces. New memories. Forget tasks to do, procedural type stuff. Things start to break down. But now it is to the point, when he was put into the hospital and when he was transferred to the nursing home, he could only mumble two kind of words or 3 words, but he seemed like he could understand, and his attention span was maybe about 5 minutes. But now in 2023, it's more fear. He's in a fear mode. He might cry. He might be a little bit more negative to what the nurses may want him to do. So he may be pushing back on that, on them, on that. So he's kind of like, he's in a fear kind of fight to try to not do what they want him to do mode now. And I, go back to, should we have intervened? And it's hard. It's really hard. We probably should not have intervened, but that would basically mean that you would have to have your parent starve to death, have their kidneys fail. Eventually, the heart fails and they die. Or do you intervene and have them go through this long process of decline, with good care? I mean, he has a good heart, good lungs. I mean, everything's, his the rest of his body is in good shape. Because of that, this thing could last 8 years, 10 years. He's 78, 78, 79. I think he's 79. No, he was born in 43. So this year he'll be 80. So he's mentally declining, but his body is still in shape. And they're taking good care of him in the nursing home. So the rest of his body isn't declining as fast as his brain. So he can maybe, move, he may be 88 by the time he dies. But the thing is that we couldn't even tell him. This is another point when you're dealing with parents that have dementia. We couldn't tell him that his wife, our mother, died, because we didn't know what that would do to his mental state. Would it register? Would he, relive that pain continually? So we decided not to tell him, right? So he doesn't know. He's probably at a state now that, he doesn't kind of he sort of recognizes faces, but sort of doesn't. And he's not really there, and he's not talking at all. And, he's fighting, and, as he's declining in his mental capacity, he's starting to show emotion. There's an emotional state of fear. Seems like he's scared at times. He's sad at times. So there's an emotional state as these neurons are starting to die off. There's kind of an emotional component to it that starts to unravel. Before, he was basically very calm, not afraid at all. Paid attention to the nurses, mumbled a couple words. But attention span was short, less than 5 minutes. Now it's, 30 seconds or something like that. So there's a lot of emotion for the survivors of the family. You have to sit back and go, should the intervention have happened? Sitting back and going, oh, that was when it started. If I just saw, maybe if we were more attuned to what was going on, we could have prevented this. Then the complexity of him being the caregiver for my mother, and because he was declining so fast, she declined because, things like that just happen, right? So, some of the lessons learned, I guess, with family members dealing with this kind of thing, with dementia or ischemic dementia, you have to pay attention to the signs, the early signs, and get them treatment right away, even if they're and my father was kind of fighting it at first. Nothing's wrong. When an elderly person I think they sort of know that it's happening, but they have cognitive dissonance, and they want to pretend that it's not happening. And this is what you have to do. You have to force them into the doctor and get treatment as fast as possible. There's some treatments that are starting to get online with Alzheimer's, ischemic dementia. Maybe through medication to increase blood flow might slow down the progress. I don't think that there's anything that if you catch it early that you're going to prevent it. I think once you have it, it starts. I don't think you can really prevent ischemic dementia. I'm not, but I think that if we caught it early, his decline wouldn't have been so fast. Yeah. But the problem is that even the doctors that were working on him in the hospital, they say that this is underdiagnosed. They would say, because the signs at that time in 2018, 2019 were very similar to Alzheimer's, right? So even he said that ischemic dementia is an underdiagnosed or misdiagnosed situation with these patients. So even if we had the doctors looking at them, they probably would think that, well, like we were, that this is probably the early stages of Alzheimer's. He didn't have any Parkinson's issues, no tremoring or anything like that. But there is that, catch the signs early, get them into the doctor early. Try to rule in or rule out different diagnoses, the differentials of the patient. And probably because of this post-COVID era, we may be seeing more of this kind of thing going on. Blood flow issues, amyloid plaque issues. But for my father, it started in 2018. But being locked down probably helped accelerate the process in 2020. Yeah. And then, the issue with dealing with parents that are both crashing at the same time, making, and then having the realization they have to be both in a nursing home for different reasons at roughly the same time. A situation where, do you pick to save the parent or not? Intervene with extraordinary measures or not? It's not easy. It's not easy. And then now, because we picked the path of intervention, now we're dealing with all the after effects, such as his severe mental decline. If we just let him go, he wouldn't have been suffering. So there's this component. It's like we intervene and try to save him, and maybe he'll be 50 or 60 or 70% of the way he used to be. But if I knew where he's at now, I don't think I would have intervened. But it was a difficult situation. You got different family members. We made this decision as a family. And it was difficult. What do you do in this situation? There's no real right answer. There's really no right answer. There's a part of me that says, you know what? I wish that we went down the other path and didn't intervene so he wouldn't suffer. Um, but then I know that if we picked that path, then there would have been a shoulda, coulda, woulda kind of moment. Should we have intervened? Maybe it would have given him, a better outcome because we would have never known. This is the problem. This is the problem with this dealing with this. So there's so many elements of it. Catching it early, dealing with parents, transitioning into a nursing home. My mother was really fighting that situation. Um, Dealing with it all during the COVID era, having a parent die from SARS-CoV-2 and heart complications, and seeing this decline in my father with ischemic dementia. It's not easy. It's not easy. And then, on top of it, being in medical school, one, the stress of just being in medical school and dealing with all these parent issues when they're elderly. A lot of people that are in medical school, they're in their 20s, maybe early 30s, so their parents are still relatively young. Their parents are still relatively healthy in most cases, not in all cases. So they don't have that extra adulthood stress, adulthood problem. So now we, have a parent, my father, that doesn't know us, or at least we don't think he knows us, isn't interacting uh, at much. I mean, within seconds, it's 30-second attention span, and now he's moving into that fear mode. He's moving in that fear mode and crying and pushing back. Um, but it could be a lot worse. I mean, maybe it will get worse. I don't know. But sometimes I just wish that I wish that he could go peacefully and not have to suffer this way. And this is why I go back to, like, well, maybe in 2021 we should not have intervened and let him pass in the hospital. And even the doctor that was the main ER doctor, um, that my brother was dealing with, you could kind of see that he knew where this was going to go, and he was kind of like pushing. He was not pushing, but he was kind of like, you sure you want to enter? We could do all these extraordinary measures, but the outcome, we don't know. And he's being very forthright. But when you're in that situation, you see these patients on a regular basis, you basically know what the bell-shaped curve is for these patients. What the major outcome will be within two standard deviations. And it probably would have been better to let him pass. But it's not easy. It's not easy to be at that fork in the road and make that decision. He doesn't know that I graduated from Harvard. He doesn't know that I'm, a third year medical student. He just doesn't know what he used to know or used to care about. Um, what is interesting about the situation he's in, according to my brother, is that he'll track to a TV. The moving pictures on the TV kind of gets their attention. I don't know why that is. I'm sure that when I'm in psychiatric care, or neurology, I'll learn the reason why that is. I don't know yet. But it's very similar to a kid. You put them in front of a TV, and that's kind of like the babysitter, keeps them, you know, engaged. The flashing colors and pictures, I think, keeps them engaged. But that's how a person like myself, dealing with two family members that had something catastrophic happen very close together. All the problems that you got to deal with, you know, cleaning their house out, memories, holidays, decisions, should we have intervened or not intervened? Um, Decisions like not telling him that his wife died, um, seeing him kind of in a fear mode now. I'd much prefer him not to be in that. We didn't want that to happen. But this is the progression of dementia. You gotta, this, and each person will be different because different areas of the brain are declining. My understanding is with the ischemic dementia, most of it is by the hippocampus. But as probably brain function starts to decline, then it's other areas of the brain are probably atrophying also. But dealing with this problem, seeing him in this fear, it's not something that you want. It's not something that is desirable. And so when we make decisions for our family members or our parents, sometimes letting them go is better. But it's that fork in the road. Should you intervene or should you not intervene? If you intervene and everything is great, you hit a home run. But a lot of times you intervene and it's not a pretty picture. And so you regret it. But yet if you didn't intervene and they passed away in a short amount of time, then you'll regret that you didn't intervene. So there's no good solution. So during the holidays, or those annual events, memories of your parents creep in, right? No matter how much you want to push them away, because sometimes it makes you feel sad, but other times they make you feel happy. So I guess sometimes letting them into your soul, into your consciousness is a good thing. And then, because I'm older, I decided to do this path to be an MD. It takes so much of your time, so much of your energy to train to help people that sometimes don't deserve help. And sometimes they don't want help. And other times they need help and want the help. But the sacrifice to go through this, you're pushing aside times that you should be spending with family, times that that you should spend more quality time with individuals that are important to you. Going through an MD program, it's like all encompassing. It's like your way of life, the way they make the program, the way they design it, the way the social constructs of being an MD, all this stuff. It's like, it's a way of life. And it's kind of like, it's almost like a monk being a monk, prepare to take all these tests. You can't, unless you're a nurse or a doctor already, an MD or an DO, no one will understand all the hoops and all the testing, because you're not just taking a test, you have to prep for the test. And not only that, you got to do multiple preps for a test. And then there's shelf exams, and then there are board exams, and there are recertifications, and it never ends. So you're always studying and always being away from activities that other people are doing. And so I think the ones that are not doctors and nurses or PAs or I don't think they really, I don't think people understand the sacrifice, the mental, the physical, the emotional sacrifice to be down that road. And it's almost like a monk in a way, you know. And I don't think it needs to be that way. It shouldn't be that way. They need to rethink how medicine is taught. They need to rethink all the trials and tribulations of a medical student, especially when medical doctors are leaving and not nurses are leaving in mass droves across the United States because of all the problems. You know, there's too much regulation, there's too much paperwork. The insurance companies don't reimburse enough. The insurance companies are telling you how to practice medicine, yada, 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 right? So there's a sacrifice, you know. If I knew the sacrifice, I would have just enjoyed my life and retired early. Um, so that was another added component to the issue with my father. Spending too much time learning how to heal other people. Meanwhile, I couldn't intervene, stop what was going on with my father. And you know, that kind of erodes at the soul, you know, especially with people that don't deserve it to be helped. Because, you know, let's face it, some people don't deserve to be helped because of, you know, their lifestyle choices, their issues. Um, Now that's kind of being judgmental. You know, I shouldn't be judgmental. That's not the proper way of looking at it. But I'm human, and when you look at the situation, you see that you know some people are doing really well that you don't feel as though they should, while others are not doing well, and you don't understand why God didn't intervene, or why karma is, so negative on one person, karma is so good on another person. Yet, you know, it should be reversed. Sometimes bad people get rewarded and good people get punished. But why? I mean, this is like a big philosophical, religious kind of question. But that's how a son is looking at a parent with ischemic dementia, where he's at the point where he doesn't know as much about his surroundings. He's fearful of what's happening. He doesn't know much about what's going on in the outside world, especially in his own family. And there's a fear. There's a fear component that's starting to develop, and it's sad because you want someone to go peacefully, to go through this process peacefully. But as neurons start to degrade, you don't know how what their thinking is. You know, it may go into kind of a reptilian mode where it's just fight or flight, type situation, while all the other aspects of humanity and the neocortex is basically atrophied. And all the emotional components that that are that are happening with the surviving family members. It's not easy, you know. Just about every other day, I think about that moment in time where we made the decision to intervene or not at the hospital for my dad. What do we do? Let him go or fight it out? And there is no good solution. So that is what's going on with my father. Hopefully you understand a little bit more about some of the early signs. You know, it seemed as though to us it started for him in maybe the summer of 2018 and it really started getting bad around 2020, where it's like, wait a minute here, there needs to be some intervention here. But he was at a point where, you know, he was fighting that. He didn't want to do that. So you got to see these signs, you know, they're showing decline, maybe convince them to get early treatment. Maybe that helps. Maybe it doesn't, but try to get early treatment. But you also have this component that they're fighting. They don't want to admit that they're having a problem, even though they probably are realizing they're having a problem. You know, when it gets really bad, those big decisions in the hospital, do you save them or you don't save them? You know, when it's life or death situation, do you intervene or you don't intervene? Sometimes it's rough to say, but sometimes letting them go is better. And it takes someone really wise to you know, make that call. So thank you for listening. I'll do a video on the market also. And please subscribe to all my channels. I have 3 YouTube channels. I have Brighteon, Bitchute, and Rumble, so also subscribe to those. All the links are in the description of all my videos. So you just click the link in the description and it'll go to those different channels, subscribe to all of them. Please support my work by being a Patreon subscriber for a nominal fee. You'll be able to see my content there too. If you'd like, please donate. You can donate on my website, the-studio-reykjavik.com. All the links are in the description of each video. Click the link to my website, and on the home page at the very bottom, you can donate through Stripe or through PayPal. You can also donate by purchasing Buy Me a Coffee, and the link is in the description also in the video. So those are some ways to support my work. Better yet, go to the store, the-studio-reykjavik.com, and get the supplements that I offer. I have a lot of really good supplements in nano silvers, in boomer supplements, C60, which is a very strong antioxidant, and all natural deodorants. Right? So just some of the things that I have on the store. Right? I have I partnered up with 2 different laboratories, Amio and ABL. So, you know, you can get liquids, gels, soaps, lozenges, but I also, one type of silver gel from Amio I sell. So you can purchase this. I think it's 35 ppms. It has a really nice dispenser top to this. I also have the ABL gel, silver gel. You know, we were talking about cardiovascular health. You know, we're talking about ischemic dementia, and there's lots of different problems that can happen with the vascular system and the cardio system, right? But you want to be able to control your lipid profile, you know, your cholesterol, have higher HDL, have lower LDL, right? So a good way to, you know, create that balance, right, is to take care of your health. Proper exercise, proper diet, but also omega-3 will help with controlling that lipid profile. When you do that, you're reducing the chances of buildup of plaque, all right? Plaque basically happens where you get an endothelial injury. The intima of the vascular system gets injured. And eventually what will happen is that you will have macrophages kind of get in there, and LDL will get in there. So these lipids, and the macrophage will eat up the oxidized LDL and create plaque. And then eventually you have some smooth muscle cells that kind of come in to that region. Sometimes you get calcification also, and it builds up this plaque with this fibrous cap, all right? Sometimes these things can burst and you end up having an embolism, or sometimes, flow isn't very good and you clot, and you could have an occlusion through clotting. So if you control the lipid level with omega-3, and you control the oxidative LDL by taking strong antioxidants like C60 and taking K2 MK7 and D3, and reduce inflammation by controlling your blood glucose levels by taking ashwagandha, you're reducing these plaque buildups. The ability for them to continue to form diminishes, and the ones that have formed will start to shrink. So what you really want to do is take omega-3 every day. Now, in addition to that, a lot of people aren't digesting their food properly. So it's important to properly eat and exercise, but you also need to repopulate your gut with pre and probiotics. I have two different types, in a capsule form and in a powder form. All right. So you can purchase those and repopulate your gut biome to help digest. But in addition, to break down carbohydrates, proteins, and lipids, take the digestive enzyme complex. This is you'll be able to extract more energy out of the compounds that you're eating. You won't have to eat as much because you're extracting more of the energy. And you will have more nutrients that are coming in to heal your body. If you have a chronic absorption issue with your gut because not proper gut biome and not proper digestive enzymes, what will happen is that your body is not at an optimal state. So please, try the digestive enzyme complex to help break down those carbohydrates, lipids, and proteins. In addition, taking a set of B vitamins is important. Okay, there's different types of B vitamins: B1, B3, B2, B6, B12. Right. So this one has B1, B2, B3, B6, folic acid, B12, and B5. And this will help with nerves, with metabolism, being able to And like B12, like for example, a lot of people, especially when they're older, they may not be, this goes back to the absorption issue. Oh, a lot of people, when they get older, they're not absorbing uh, nutrients as much. Sometimes their intrinsic factor is a little low. Their absorption isn't that great with their gut. So they're not digesting and absorbing the B vitamins as much as they should. And for example, if you're not getting enough B12, you're going to start having neurodegenerative situations in your spinal cord. So here's an example where you need B12, but also metabolism. In biochemistry, there's a lot of different pathways, and you have these cofactors. Some of these cofactors are B12s to help to go through the next chain reaction in the biochemistry to make certain chemicals, to make certain molecules, right? So when you don't have your cofactors, that whole process isn't as efficient, or it doesn't even work. It stops. So making sure that you have your different vitamins, your B vitamins, is going to help you with the metabolism and also with neuroactivity. So taking a B complex, taking the vitamin B complex, is going to help you a lot. And again, it goes back to that coupling effect that I was mentioning earlier. Taking C60 to reduce that reactive oxygen species, taking the probiotic, taking the digestive enzymes, and all of a sudden your health starts to increase because you're getting more of the nutrients from proper eating and supplementing at higher concentrations. And what will happen is that you're slowing down the aging process. When you don't have enough ATP, your body starts to wear down, and it wears down much quicker. This is why older people get older quicker. Magnesium and zinc. I have supplements here that you can take. Taking this regularly is going to improve your health and immune system. You know, we heard a lot about taking zinc and how important it was during the crisis. And then, you know, I have a 2 ounce, a 4 ounce, and a 8 ounce bottle of C60 in coconut and avocado. This one is 2 ounce for $60. But basically what you do is you take this every day, and this is a very strong antioxidant. It's a buckyball. It's a molecule that has 60 carbons. So it looks like a soccer ball, right? And what that does is it can soak up and deactivate the reactive oxygen that is produced at a much faster rate than vitamin C. Vitamin C is just one molecule, right? And there's a ring in vitamin C that can neutralize the reactive oxygen species. But once that ring has neutralized the reactive oxygen species, that molecule cannot be used again, and it just gets excreted. C60, because there's so many, when you follow the electrons cloud of the molecule, it can soak up these reactive oxygen species and be reused instead of one shot and can't use again, like vitamin C's molecule. So this is the reason why it's so potent, why it's so good. So taking, you know, a dropper of this, I take a teaspoon of it a day. And what you'll notice is that you're bringing down the reactive oxygen species. You're bringing down the the um, the the degradation of the cell, and you're boosting up the mitochondrial health. That's helping with producing ATP. More ATP, more energy. It helps to heal your body. You're slowing down the aging process. That's how it works. On top of when I was telling you about the plaques, by taking C60, you're reducing the oxidative LDL that is being eaten up by the macrophages. Less oxidative LDL, less plaque. So taking this is going to help you reduce the buildup of the oxidative LDL. On top of what I was saying about taking the omega-3 and bringing down and controlling your lipid levels. So those are the things that you can take on top of nano silvers that neutralize pathogens, soaps and lozenges, liquids and gels, the C60, which is a strong antioxidant, the all natural deodorants that I have from Rainbow Herbals, citrus, and then I have another one in peppermint and tea tree. Those ingredients are all natural, mostly organic, and from the Himalayas, you know. So these ingredients that are in these deodorant bars are like the highest quality ingredients that you're going to be able to get. So, you know, I offer a lot of products on my store to help support my work. So a great way to help improve your health and to help support the channel is to go to the store, the-studio-reykjavik.com, and get some of these products that will help boost your health, help slow down aging, help neutralize pathogens, help reduce reactive oxygen species. Start using all natural deodorants. And what you will see over time is an increase in your health. Taking collagen every day will help improve your bones and your cartilage and your skin health. I sell a nano silver toothpaste, no fluoride in it. It is the best toothpaste that you'll ever use. It neutralizes the pathogens in your mouth. It whitens the teeth, right? And it's reducing cardiovascular disease. This is when you have a really strong toothpaste, you're reducing those chances of cardiovascular disease from having a better oral care. Something very simple as a toothpaste can radically change your health when you're using it every day. So take a look at that. That's a really easy, it's the best toothpaste that you can buy. There's no other toothpaste that you can buy that's as good as that toothpaste that I sell. Much better, by leaps and bounds, much better than any toothpaste that Alex Jones is selling. So go to my store, the-studio-reykjavik.com, and help support the channel. Thank you for listening. Thank you for staying with this and learning a little bit more about ischemic dementia and some of the personal experience that I have seen dealing with a parent going through this ailment. Thank you for listening, and have a nice day.